I'd like to welcome to Fever FM today Dr. Sundhya Raman, a BSc Honours MBBS DPhil Oxon DIPL BSLM IBLM. My goodness me, that's a lot of initials after your name, Sundhya. Sundhya is a medical doctor and a qualified lifestyle medicine physician. She also has a PhD in genetics, and after working for several years at hospitals in Brighton and London, took a career break to focus on her family. Her journey into lifestyle medicine began when she took her own family and researched the best choices she could make for them in terms of physical and mental well-being. She found that there are a wealth of quality studies showing the staggering benefits in both the short and long term of making positive lifestyle choices. So welcome to Fever FM, Sundhya. Real pleasure to have you joining us here today. And just hoping that you're going to give us a bit of a flavour as to what you've seen in your practice since becoming a lifestyle medicine doctor, which may be a new term for some of our listeners, although we have had a few interviews where we've been bringing up the subject in the last weeks. But I guess, first of all, welcome to the show once again. And perhaps you can give us a little bit of an understanding, Sundhya, as to what is lifestyle medicine?
So thank you, Lokesh, for that lovely, lovely introduction. I'm really excited to be here today. So lifestyle medicine is all about how we can use our lifestyle. So that includes the way we eat, the way we move, the way we sleep, how we manage our stress, whether we have alcohol or other sort of potentially harmful substances, and whether we foster and nourish our social connections. And all of these aspects are what we now understand incredibly potentially protective against this incredible rise, this tide, this tsunami of chronic disease that is affecting so many of us and our loved ones. And according to the World Health Organization, about 80% of these chronic diseases, things like heart disease, diabetes, dementia, and 50% of cancers, could be potentially completely avoided if we made different lifestyle choices. And so there is this burgeoning field of lifestyle medicine where a lot of doctors and other healthcare professionals are learning about how we can use lifestyle changes in an evidence-based way as tools to really preserve the health of people over their lifespan, rather than what we currently do is we allow people to reach a tipping point of disease and then we intervene, often with a lot of medications that potentially have side effects, or at best just tackle symptoms or slow the progress of disease. But ultimately, what we'd really love to be able to do is prevent chronic diseases altogether and give back people that health span that most of us would like to enjoy for the entirety of our lives.
So, I mean, you mentioned that there's a tidal wave of chronic disease at the moment. Is that why lifestyle medicine is needed? I mean, why is lifestyle medicine needed in today's, 2023, in today's day and age?
So exactly that. We have an epidemic rise in levels of diabetes, obesity, and a huge number of other chronic diseases. 1 in 2 of us will probably develop cardiovascular disease, so heart attacks, strokes, heart failure, things like this over our lifetimes. And Chris Whitty, his last report on the state of the health of the nation in 2019 said the average person, not the unlucky person in the UK, but the average person can expect to spend 1/5 of their lives, that's about 15 years for both men and women, suffering with at least one chronic disease before they die. So we are losing a huge proportion of our life and spending it with a poor quality of life. And so what is pretty unsustainable with an aging population is to allow people to just head in this direction, which the majority of us are expected to head towards, and just maintain people in the sick state for the last decade and a half of their life. And actually, in the more socioeconomically deprived areas of the country, it's about 1/3 of lifespan
right, wow.
that people will spend suffering from at least one chronic disease before they die. So that is not a way that we want our loved ones to live. We don't want to live like that. Doctors don't want their patients to live like that. What would be wonderful is one, training doctors in lifestyle medicine and nurses and other allied healthcare professional, pharmacists, etc. And there is a growing appetite for that amongst healthcare professionals.
I mean, I've got to say, I myself have had an interest in this area for the last 10 years. And when I first started looking into this, when I came back into the UK some 7 years ago, there was very little to be found in terms of lifestyle medicine or these kind of approaches. But just looking at it again in the last few weeks, I can definitely see that there's been a big evolution. There's a lot more doctors who are being trained in lifestyle medicine who have an interest in nutritional studies and how it can impact their patients. So there's definitely some progress. I wonder how much. I'm sorry?
But there's some way to go.
There's some way to go. I think we can both agree on that. So interesting. So for which diseases and conditions would you say lifestyle medicine is most effective?
So I would say for nearly every chronic disease. So as I said, the World Health Organization says 80% of our dementia, diabetes, heart disease, chronic lung diseases, all of these could be prevented. And actually, they talked about just 4 lifestyle factors. If we change those and optimize those, then we would avoid these diseases, about 80% of these diseases, and about 50% of cancers. Now, actually, some of those cancers, some predictions say it could be as much as 90% of cancers. There are certain cancers that are associated with particular occupations, for example, and so on. So that one is a little bit more difficult to judge quite the impact that we could have in terms of lifestyle.
So I mean, let's just look at the ones that are very common highlighted amongst the Asian community in the UK: cardiovascular disease, diabetes, kidney disease. Am I missing anything?
Dementia. Yeah. These are really, really interesting ones that you've brought up because so cardiovascular disease begins, the first evidence of it is apparent within the first decade of life. So by the time a child is 10 years old, they're already laying down those fatty streaks in their blood vessels. And we continue doing that over many, many, many decades. And then we, at the moment, the way we manage it is we make a calculation based on your risk in most healthcare systems, including the NHS. And at that point, if you reach a threshold, even though the same disease process is going on for many, many years, it wouldn't be really reasonable to start people in their 20s and 30s on drugs to lower that cholesterol. But we know that lifestyle is just as effective, if not more so, in some cases, in reducing that risk, so that we could be practicing that all that time over those decades and completely avoid developing cardiovascular disease. But we need the education and support in order to do that. So one of my roles, for example, is I have recently become the lifestyle lead at the Primary Care Cardiovascular Society. And this is one of the things we're aiming to do, is create evidence-based lifestyle advice for cardiovascular disease for healthcare professionals, things that they can take into their practice, relate to their patients. The next stage, the best case scenario, is then empowering and facilitating patients to actually incorporate those changes into their lifestyle. And that is, so a lot of people can be given information, but actually that next step in showing people how they can add that into their lifestyles can often be the difficult thing. So at the moment, I'm doing a project with a GP practice, and we're using lifestyle change to lower cholesterol. And I had one session with my group of patients where they came in and they tried food swaps. So in theory, when I was talking to them before, they were like, I'm not sure I really like soy. I don't like tofu. I don't like this. I don't like that. And then you give it to them and they're like, actually, that is not a compromise. That is delicious. I'd be happy to eat that. So, in fact, taking the risk out of behavior change is incredibly empowering for people. And you can start to help people to understand that what they're changing isn't about deprivation or willpower or struggle, but is actually just learning new skills. And you can live with abundance, and you can live with you can eat abundantly, but all you need to do is make the main part of your plate these wonderful, spicy, varied, rainbow filled dishes. But a lot of people just don't know how to do that yet. Once you actually teach people those skills as well, and what I'm finding is people are running with it. We often presume things about people and we say, this is going to be too hard for people to do. What I'm finding in my experience is it really isn't. People are, when I'm now meeting with people, what sounded hard at the beginning, they're often achieving much more than we had planned week by week and incorporating changes into their lifestyles that at the outset sounded impossible, but they're actually embracing, not just as individuals, but often as families. So it's been a really, really positive experience. I think we underestimate people and how much they want to partner with us as healthcare professionals in preserving their health, in optimizing their lifestyles. Many of them are saying to me, you know what, I can fit into clothes that haven't been able to wear for years.
Which is very motivating, isn't it, for something like that to happen?
Absolutely.
I mean, they say that lifestyle change is amongst the most difficult things for people to do. And so I think, hearing, a doctor like yourself has a unique place in society to be able to encourage people to have that change. And it's refreshing hearing that from you, because a lot of doctors that I talk to about lifestyle changes say, look, we just don't have the time, and people don't necessarily have the motivation to change. But as you're observing, actually coming from the right person, a doctor, with the right kind of resources and direction, you've seen it to be pretty easy for people to change towards more healthy options.
Whether they stick with all the changes. But I have been overwhelmed and absolutely delighted. I am in a relatively privileged position that I am doing this separately from the NHS. So I do have the time to spend with people, but what I'm learning through this process is how we can make this much more scalable and much more applicable to more people. And I think that there is absolutely the ability to make that possible and doable for a huge number of people. So we need to begin with good quality information out there that is accessible in bite-sized pieces, both for healthcare professionals as well as for patients, and to really emphasize how powerful this is, how it is not a nice to have and a little bit of a garnish in terms of healthcare. It is absolutely front and center and a foundation for people to be healthy. And I think this is a shift that we need to see.
Okay, good. So you mentioned earlier on that we've observed, as I've seen in studies as well, that children as young as 10 years old are already putting down these fatty deposits in their arteries. So what is it about the food that's causing this buildup of fat that ultimately leads to disease or disability? The leading cause of death in Western countries is cardiovascular disease, and probably one of the leading causes of disability is cardiovascular issues, right? That stem from that.
Exactly right. So yes, 1 in 2 of us predicted to develop cardiovascular disease over our lifetimes. That's more than the double the number of people that will develop cancer and Alzheimer's combined. So it is our number one health problem. And exactly as you said, stroke is our number one cause of severe disability. So it is a huge impact, not just on people, on death rates, but in terms of quality of life as well. Absolutely, you're right.
And a massive impact on families, on society, the health services. Like the implications are huge, aren't they?
Exactly, that ripple effect is enormous. And I think we probably all struggle to think of somebody, to say that we don't know somebody who has cardiovascular disease, that it hasn't impacted on our lives or the lives of our loved ones.
I mean, I guess just another point coming out there, we're saying 10-year-olds are laying down fatty deposits. But just to personalize this to the listener, what that means is if you're living in the West, undiagnosed or whatever, in all likelihood, you too also have these fatty deposits build up that are going on inside you as well.
Absolutely. So, and that build-up is silent. So having a high cholesterol is a silent process. We don't get symptoms from that until it reaches a certain threshold. So if you are over the age of 40, go get your health check from your GP, and they will check your blood sugars, check your cholesterol, check your blood pressure. These are all things that, we can actually make changes in our lifestyles in order to reduce our risks. But first of all, you need to go get these tests done. But irrespective of whether you get the test done, the changes you can make will benefit you irrespective of that, because exactly as you were asking me, Lokesh, what is it that is driving this fat to be laid down in our blood vessels? And what we really understand is there are three things that raise what we call our bad cholesterol, or our LDL cholesterol. So a lot of people would have had their cholesterol tested, and they would have got three or a few readings. One is their LDL cholesterol. We often call this our bad cholesterol. And then we would have something called our HDL, or high density lipoprotein cholesterol. We often refer to this as our good cholesterol. There's nothing inherently different about the cholesterol in our HDL and LDL. It's really telling us about the direction in which this cholesterol is traveling. So our LDL cholesterol is really the cholesterol that is going away from our liver out into our bodies. And potentially, if it's above the range that is healthy, it is potentially being laid down in our blood vessels. Our HDL cholesterol is really a measure of the cholesterol that is traveling from around our bodies back to our liver, potentially then going into our intestine and out through our feces. So that is really what our HDL and LDL cholesterol are really a measure of. Now, our LDL cholesterol, the primary driver of raising our LDL cholesterol is our diet. And in our diet, there are three things that raise our LDL cholesterol. One are trans fats, two are saturated fats, and three is cholesterol itself. So trans fats are found in all animal source foods. So that is meat, red meat, poultry, and eggs and dairy. It's also found in processed foods like biscuits, cakes, these sorts of ultra processed pastries, things like this. So we knew about trans fats back in the sort of 80s and 90s when we had those hydrogenated fat margarines. And then they said, oh no, look, these are terrible for us. But we didn't ban trans fats in this country. We asked the food sector to remove them from our diets, from our foods. So actually, they're still there. They're just less visible sometimes, but they're there in our industrially processed foods like pastries and donuts and cakes and biscuits.
If I'm right, Sundhya, then so trans fats, obviously in processed foods, you'll find them. You'll find them quite commonly, but amongst unprocessed foods, typically they would only exist in animal products. Is that correct?
That's absolutely right. Yes. And we used to have a question mark around whether these animal source trans fats were as damaging as the ones from processed foods. But actually, there is no safe lower limit on our intake of trans fats, none. And the Royal Society has said that we cannot see any difference in the impact on our cholesterol levels, on our risk of heart disease from processed foods, trans fats from processed foods, and trans fat from animal source foods. So there's actually, we're not seeing that these are any safer, the ones in animal
They're
source
just bad,
foods.
full stop.
They're all bad. They're all bad for us. We should absolutely minimize, or ideally absolutely avoid trans fats in our diet. Trans fats are actually, in practice, most of us are not, depending on the individual, most of us are not eating huge amounts of trans fats. What we're really, really massively over consuming are saturated fats. Now, saturated fats are found in pretty much the same culprits. They're found in all animal source foods, again, in processed foods. They're found in eggs. And they're additionally, for anybody who's on a plant-based diet, they're found in coconut oil and palm oil. So if you're worried about cardiovascular disease, these are things to try and drive down on and ideally minimize or avoid. If you have a high cholesterol, I would say avoid these fats.
Okay.
And finally, cholesterol itself. So it contributes the least to raising our LDL cholesterol, but about 15 to 25% of the population are what we call hyper-responders to dietary cholesterol. So they will get the triple whammy from the trans fats in those foods, the saturated fats in the food, and the cholesterol in those foods to really bump up that LDL cholesterol, or what we call our bad cholesterol. So cholesterol is found, again, in all animal source foods. So that is red meat, white meat, dairy, and eggs. And that's where you find cholesterol. On the flip side, plant foods have things called phytosterols, stanols and sterols. And what these are is they're the plant version of cholesterol, and they actually compete at cholesterol receptors. So they drive down our cholesterol, and you'll find those in all unprocessed plant foods. And they're concentrated in spreads like Flora Proactive.
Really?
Yes, and that's what plant sterols and stanols do. They're the plant version of cholesterol. They lower our cholesterol.
Okay, interesting, because I thought they would do a very highly processed food, kind of flora, etc. So I wouldn't have imagined
processed food, but they've actually used them in studies because it's very easy to measure.
Yeah.
And that's the thing that often nutrition studies struggle with, is how to look at the quality of people's diets and then demonstrate an outcome.
And typically, I think flora back in the day was kind of responsible for bringing hydrogenated fats in a large degree into my personal diet. Anyway,
that's one of the exactly, that was the evolution of these. But now, one thing that they have shown in, for example, something called the portfolio diet. So a gentleman called David Jenkins in the States, he designed something called the portfolio diet, which is a cholesterol lowering diet, and it emphasizes foods that lower cholesterol, such as nuts, plant protein, fiber, and plant sterols and stanols, and they gave those as a spread to people. So yes, I absolutely agree with you. If you can avoid processed and ultra processed foods, that's even better. You bulk up the plants in your diet. But if you have a high cholesterol, you can actually use things like these spreads, and that has been shown to actively lower cholesterol.
Okay, interesting. So these fat deposits that we're seeing in children as young as 10 years old, that in all likelihood almost everybody who's listening probably has got going on inside them, are set down through the interplay of trans fat, saturated fat, and dietary cholesterol. Which you could avoid in your diet just by avoiding all processed foods and all animal-based foods. You would omit that entirely.
Palm oil and coconut oil, minimize
and
these.
Palm oil and coconut oil, of course, which palm oil you can, is again in almost all processed foods out there as well.
Yes.
So really interesting. Sundhya, let's we're going to end part one here, but let's come back in part two, where I want to find out a little bit more about your experience in your practice of lifestyle medicine, how your patients have taken benefit from it, what kind of changes you've seen, and all of that good stuff. So if it's okay, if you can hold tight with me for a little while, and we'll come back for part two.
Sounds great, Lokesh.
Thank you.